Well, it's been very progressive. We started from nothing. We had no baseline institution of a state health insurance scheme to copy from. So we learned the hard way, but thanks to His Excellency, the Executive Governor of Delta State, and other stakeholders who had provided us that enabling environment to start off and grow, particularly the labor organizations that believed in us from inception, and the community leaders that accepted us and gave us that encouragement to get into their communities and reach out to their people for access to quality healthcare services.
Well, I think it's innovative, and there are lessons to learn for scale-up and replications. Of course, as an health system person, I've had the opportunity of studying options like this. I think what came to my mind is what I've seen in Cambodia. I was in Cambodia 2006, but of course that one was donor-driven, what they call contracting in and contracting out system. So it's a similar thing, because what you see here is that you see government trying to provide health for its people, particularly those that are hard to reach, those that who are not accessible or who don't have access to normal health care. And they know that normal government system cannot deliver that. So they bring in the private sector. So the government owns the facility, the government guarantee the finance, and the government also created business opportunities for them. Yeah. Because as insurance enablement. Yeah. Because the government established the insurance scheme, managed the insurance scheme, and now pay the provider. That means they deal with both sides, as we said, supply and demand side. So it's a very good lesson, and I can see it being replicated. The key things which I see there, where there will be challenge, is if it has to be like some people are suggesting, if they have to do it in an urban area, there will be resistance from the unions. Because it means they are handing over facilities where you have doctors, nurses, all health workers recruited by government. You get my point? And then they will move them out of these places, because if they have to give it to the private sector may not retain those staff, or the staff also may not want to be retained under the condition of the private sector services because of pensions and also on. So, but it's something that could be replicated for areas that are hard to reach, areas that are unattractive to regular government workers. In which case, by that, we'll be able to reach the unreachables and be able to bring in on board those people into the main healthcare services.
We are specialized in providing turnkey projects in the healthcare sector, especially in Sub-Sahara Africa. I'm very proud to have been part of this session with Farm Access. I'm very impressed by the level of commitment of the various stakeholders in this project, which is necessary to have this private-public partnership project brought to a success. And I think that is an example that could be used in the rest of Nigeria, but also in other countries in Sub-Saharan Africa, and I hope to be able to be part of that.
Well, it's extremely impressive, and it goes to tell all of us that there's light at the end of the tunnel. Our people deserve the best, and like I said earlier, COVID-19, if not anything else, should have taught us one or two lessons: that healthcare is primary, healthcare is real. At the point where the whole world was closing the door at us as Nigerians, and indeed as Africans, time for us to take ownership of our health becomes imperative. So this today is a good driver in the right direction. The fact that if Delta can do it, other states can emulate. Same, because without a doubt, government can run hospitals, and hospital services should be done in such a way that there must be collaboration with private entities.
It's exciting to be here to see a great thing done by Delta State in partnership with pharmacists. So this is really something we want to push to the next level. You know, these success stories should be emulated and then scaled up. That's why I'm here. I'm so excited to see how can we participate in making sure this become a bigger thing, impact in Nigeria. For me, it's so exciting to see how PPP can transform, can make both economic and social sense, really. You see, for us to see a rundown hospital or healthcare center there's no other way of getting them back to life. Now to see all the players coming together, the private sector, the funding agencies, the government political will to make it happen really is an amazing partnership that we need to really study more and see how to make sure that it becomes a model for Nigeria to revive its healthcare system, because our healthcare system is in a very bad shape, and this gives us hope that we can get it back to shape. Because this kind of arrangement that is showing successes, we need to see how do we push it forward. Other states, because I mean, Nigeria is among the worst healthcare systems. Government cannot support everything, but if you put the infrastructure in place so everybody to participate, to make sure we have what we have here in other states too. So we're so happy to have it.
It's been a wonderful experience. It's the way to go. It's a privilege to be able to serve those who otherwise will have not had access to healthcare. It's very rewarding, at least in terms of emotional benefits, and I believe that in the long term it will be financially rewarding as well. We are creating employment, we are looking after children, we're looking after pregnant women. Since we set up our own center 3 years ago, we haven't lost one pregnant woman. Babies are delivered regularly in the hospital, and yeah, it's a good experience.
Surprisingly, it's the vision of the governor, because it was his baby's desire to provide quality healthcare to all residents of Delta State. It's been his ambition while as the chairman Senate Committee on Health. So we realized that we had a mandate, we had a vision, and it was our responsibility to deliver that vision of the governor. So with his strong political will, with his able support system he made available to us, we had no choice than deliver. But another important factor is the fact that whenever you have the opportunity of giving back to the society, it's always very refreshing and rewarding. And that was a secondary drive for us to work hard and achieve the successes we're celebrating today. The challenges are quite formidable. Some we anticipated, some we never imagined. But the good part is that because our vision was always at the goal, we did not let the disadvantages and the challenges affect us. So we developed a spirit of that whenever challenges come, we either overcome them or we manage them. And that has helped us. A very significant challenge was the fact that convincing people to believe that government will work was a problem. We came from the private sector. I'm from the private sector. So I've always had the mindset of getting things done. And to now imagine that despite your effort to get something done, everybody believed it will never be done, it can never be done, was a bit daunting. So it took us time to convince them that no, this is a different system, this is a different dynamics. Just believe in us and we'll put in that effort. So that was a very critical challenge. Also, there was this situation where the existing situation that, you know, when you want to change something is always difficult, so we got a lot of resistance to change, but over time we're able to convince them that change was better than having the status quo that was not very effective and productive. So that spirit to ensure that whatever challenge we meet, we develop the spirit to overcome it, or we manage it till we can overcome it. That's what has kept us going.
Not just Nigeria, the eye of the world is on what is happening in Delta State. How much of pressure is that placing on you?
Surprisingly, it's not pressure, it's actually a stimulant, because now we know that, you see, when you do something and it's recognized and it's appreciated and you get that support, it's amazing. So the foreign recognition we're getting is not just recognition, it's actually efforts, attempts and action to help us achieve more. So we're not just getting recognitions, we're getting strong support, both in terms of capacity, technical capacity, in terms of financial capacity. So we're actually being properly encouraged, and it's not something that should worry us. It's not a daunting task. It's something we can easily achieve, and it's actually very supportive. Like I mentioned earlier on, most of those things, if you even ask me some things about the work, I don't know. Like I said, situation just happened, took a decision, got it done, overcame it and just moved on. So to say I should start listing particularly the success factors, I might not be able to, but when you talk about the success principles, it becomes more formidable. Like I said, the first thing is come open, come clean. Talk to people, relate to them on an equal basis, not government, subsidiary, or no. Talk to them on an individual basis, and that helped us build trust, build communication. 2, ensure you have your facts and figures. You have that empirical data, information that says, I'm going to move this from here to here. This is how I'm going to do it. This is where it has been done. Or this is, despite the fact that it's not been done, this is how the situation will be done. Once you break it down and present it, like when we started this program, and we spent quite a while documenting it, planning it. By the time we came up with the product paper, the framework, and the implementation guideline, we had these 3 documents presented from day one, and we said, this is how we're going to do it. And we gave it out to experts to scrutinize it, critique it, and they said it was perfect. I mean, not 100% perfect, because when you now start implementing challenges come, but they said it was a perfect document to start with, and we presented it to everybody. So you can, if people understand the fact that before this program started, there was an economic management team set up by the governor of about 15 experts, talking of professors and co, who looked at it and recommended to the governor. After that, another set of people went through it, and then it was passed on to us to implement. So if you look at the processes we have gone through, you will see that we didn't just wake up and start. So when you now say, what was the critical factor? Is starting well, documenting well, having a clear-cut documentation. That is the first part. Then every other thing are things that are the unforeseen situations that come up that you obviously overcome. But your foundation must be very strong, very solid, very formidable, and should be scrutiny-free. The reason people look at it as mystery and magic is because they don't even understand what it is. Public-private partnership is like husband and wife. The wife has come from somewhere, the husband has come from somewhere. First thing first, how are we going to live together? How are we going to understand each other? There will be quarrel, how will we settle? So long as that understanding is there from day one. One big issue that always comes up is the issue of trust. Government has some concern that the private sector wants to grab and go. The private sector has a fear that government will not keep to its words. So what does it say? I'm government. I guarantee I'll keep to my words. Private sector, guarantee that you'll be considerate in your charges. Once you break that ice, every other thing is easy. I will tell you that he's fully hands-on. You don't just take things to him and he just passes through. You have to prove your point. When we started this health insurance scheme, I'd never forget, he had just won the primaries, and I prepared the position paper. That's just concept note. This was a 2-page executive summary, and I walked into his house. He was having a meeting with about 15 to 20 political associates. But as soon as we walked in, he told them to excuse him, and he came to us and he listened, attentively made comments, finished, put in his words, and went back to the political meeting and said, now go ahead and start. You cannot get a stronger political will. So that is the critical thing. He's very detailed, very critical, very knowledgeable, and that has helped us. So in terms of getting things done, he gets things done. But he doesn't just get things done by word of mouth. He ensures that that thing is done effectively, and is done as has been said it to be done. And that's why they call him a Kweme. We always advise people, don't replicate our template. Look at the principles and adapt it to what you do. Because the challenges I saw in Delta State may be different from the challenges in another state. But once the principles are the same, and what are the principles? Are very basic. Treat everybody equally. Be open, make sure you do your groundwork, make sure you're straight and sincere with the people, and make sure you have all the capacity and the indices that will create that enabling environment for all parties to be on the same table and cooperate, discuss, and agree. Even if while on the same table there are disagreements, let it be that the disagreements are based on an understanding. And once you do that, you'll be fine. We're all politicians. Once you're a human being, you're a politician, the question is, what guides your political decision? Is it political politics or technical politics or outcome politics? The key point is, what politics are you playing, what politicians? So for what I know, is politics about getting things done the right way, the proper way, for the benefit of all, and as we have agreed to do.
What you hear and what you see, I see that there's a large need for healthcare in Nigeria. That's known. The example on the beginning of the presentation of Mr. Sunday, that there are more than 34,000 primary healthcare clinics in Nigeria. Only 20% operational is well, stunning. And I think there's a large thing to do. If you have the primary healthcare sector in order, in good shape, as he said, it's the foundation for the rest of the healthcare sector. And ultimately, if you do that the right way, it will be a cost reduction. Healthy people can work better, can spend more money, not on healthcare, but on doing other things. So it will thrive your economy. So having a good basic healthcare is essential for the growth of every African state. I think that what Farm Access can contribute is helping to strengthen the structure and helping to enable all the parties to come together on the table and show that there is a way to get this done. Without having the challenges of the various parties, but share the common goal, improve healthcare in Nigeria. And I think that is what their largest contribution is, enabling to have that shared focus and having also some ability by the Medical Credit Fund to provide some financial support to do that.